Hello everyone. In this video, I will let you know about the concept of depression, wh- how we can diagnose depression, and how we can treat it. First of all, you have to go on Google and write down criteria of depression DSM-5, and then go to this website who.int, click on it, and then this website will appear, which will give you a brief knowledge and information about depression. What is depression? Overview. Depressive disorder is a common mental disorder. It involves a depressed mood or loss of pleasure or interest in activities for a long period of time. Depression is different from regular mood changes and feelings about everyday life. It can affect all aspects of life, including relationship with family, friends, and community. It can result from or lead to problems at school or at work. Depression can happen to anyone. People who have lived through abuse, losses, or other stressful events are more likely to develop depression. Women are more likely to have depression than men. An estimated 3.8% of the population experience depression, including 5% of adults, 4% among men, and 6% among women, and 5.7% of adults older than 60 years. Approximately to 80 million people in the world have depression, which is a larger amount. Depression is about 50% more common among women than among men. Then we will go through other symptoms and patterns. During a depressive episode, a person experiences a depressed mood, feeling sad, irritable, empty. They may feel a loss of pleasure or interest in activities. A depressive episode is different from regular mood fluctuations. They last most of the day, nearly every day, for at least 2 weeks, which is a criteria to diagnose a depressive person. Other symptoms are also present, which may include poor concentrations, feeling of excessive guilt or low self esteem, hopelessness about the future, thought about dying or suicide, disrupted sleep, changes in appetite or weight, feeling very tired or low in energy. Depression can cause difficulties in all aspects of life, including in the community and at home, work, and school. A depressive episode can be categorized as mild, moderate, or severe depending on the number and severity of symptoms as well as the impact on the individual's functioning. There are different patterns of depressive episodes includes single episode depressive disorders, meaning the person first and only episode. Recurrent depressive disorders, meaning the person has a history of at least two depressive episodes. And bipolar disorder, meaning that depressive episodes alternate with period of manic symptoms which include euphoria or irritability, increased activity or energy, and other symptoms such as increased talkativeness, racing thoughts, increased self-esteem, decreased need for sleep, distractibility, and impulsive reckless behavior. The contributing factors and preventions for depression. Depression is a form of complex interaction of social, psychological, and biological factors. People who have gone through adverse life events like unemployment, bereavement, traumatic events are likely to develop depression. Depression can in turn lead to more stress and dysfunction and worsen the affected person's life situation and the depression itself. Depression is closely related to and affected by physical health. Many of the factors that influence depression, such as physical inactivity or harmful use of alcohol. So, there are the other treatments and diagnoses about the depressions. There are effective treatment for depressions, and the effective psychological treatments for depression includes behavioral activation, cognitive behavior therapy, which is also called a CBT. Other therapy is interpersonal psychotherapy, and last one is problem solving therapy. Antidepressant medication includes selective serotonin reuptake inhibitor SSRIs such as fluoxetine. Healthcare providers should keep in mind the possible adverse effects associated with antidepressant medications, the ability to deliver either interventions and individual preferences, and one of the factor is self-care. It's play an important role in managing symptoms of depression and promoting overall well-being. So this is a video in which I explain about what is depression, its symptoms, its criteria, its diagnosis and treatment. Thank you so much.